Welcome to the Nursing Post podcast, All Nursing All the Time, with Ashley Moore and Rosa Horsley. In this episode, we discuss spina bifida and the importance of folic acid. Our goal is always to inform and to help start conversation.
Spina bifida is a condition that affects the spine and is usually apparent at birth. It is a type of neural tube defect that can affect anywhere along the spine if the neural tube does not close all the way. If it doesn't close all the way, it causes the backbone that protects the spinal cord from forming and keeps it from closing. And as a result, it damages the spinal cord and the nerves. And spinal bifida can cause physical and intellectual disabilities ranging from very mild to very severe. The severity actually depends on the size and location of the opening in the spine and or if part of that spinal cord and nerves are affected.
Of course, we have some statistics for you. These are all from the CDC. So every year, about 1,400 babies are born with spina bifida, or one in every 2,700 births, and that's an estimate. Hispanic women have the highest rate of having a child affected by spina bifida when compared to white or black women. I did look into why that happened, and it seems to be related to diet, as Hispanics tend to eat more foods that are corn-based. Since they're not flour-based, which flour was enriched to help prevent spina bifida many years ago. So because I guess white and black people are eating more flour-based products, their foods are automatically enriched with folic acid. However, Hispanics are eating corn-based, that's not enriched. So they're missing out on that vital nutrient to help with spina bifida.
That's interesting because I love looking at the statistics of things. Mm-hmm. And I did see, and was wondering, well, why are my people, struggling with this?
Right.
And when you say that, it makes a lot more sense because some cultures probably do use flour tortillas or flour enriched products.
Right.
But I know my culture, we do generally tend to stay away from those carbs because we get enough of it in other things. You know what I mean?
Right. Like the beans and rice and things. Mm-hmm. Absolutely. And to be quite honest, I prefer a corn tortilla.
Me too.
They're good. It has a lot of flavor.
I mean, healthier, less carbs. Like if I'm going to eat chips, I'm not a fan of potato chips.
Right.
I prefer corn chips.
And
so I find that interesting. Yep, that's right, girl.
So Hispanics have about 3.8 out of every 10,000 births that are affected by spina bifida, where Black or African Americans are at 2.73 per 10,000 births. And then your white population is 3.09. So actually it looks like the African American population is doing
much better
out of all of those three categories. In 1992, the United States Public Health Service recommended that all women of childbearing age consume 400 micrograms of folic acid every day to reduce the risk of having a pregnancy affected with this birth defect. And in 1996, the FDA mandated by January 1st of 1998 that all grain products to have folic acid added to them to help reduce the risk of these neural tube defects. And that's what we know now as the folic acid fortification. That's what's missing in the Hispanic diet. Mm-hmm. And since folic acid since that fortification began, there are about 1,300 babies born each year in the United States without a neural tube defect that otherwise would have been born with one. So that's a pretty good chunk.
I mean, it's improvement, but I feel like we can do more.
Well, I mean, to me, there's a very big, glaring, obvious thing that you can do here, and that's fortify corn-based products.
Absolutely, and education.
Right.
And of course, when we go further down into this rabbit hole of ours, we'll bring some other topics up to help discuss that.
And hospitalizations related to birth defects of the brain and spine, and that includes spina bifida along with other defects, cost more than $1.6 billion in 2013. And that's for any age range,
Mm-hmm.
just in general. So you can see where there's a lot that we can do to help.
Absolutely. There are a few types of spina bifida.
Yes.
Occulta, root word is occult. I think
Mhm.
we all in nursing pretty much know what that means. It's kind of like the synonym for hidden.
Right.
So in this form, it's called hidden spina bifida, as the cord and the nerves are usually normal and there's no opening on the back or near, like the spine.
Right.
There is only a small defect or gap in a vertebrae that make up the spine, and that occurs in about 12% of the population. In many cases, spina bifida occulta is so mild that there is no disturbance of spinal function at all. And most people aren't aware that they even have it unless it's discovered on an x-ray performed for like another reason. I don't know, maybe like you had a kidney stone
Right.
or,
It's an
upper
incidental finding.
respiratory, you know what I mean? They didn't find it on purpose.
Mhm.
And 1 in 1,000 individuals will have an occult finding that leads to neurological defects or disabilities. So you have to remember, like when you're talking about the spine and all the nerve
Mhm.
endings and everything, that the spine does, because with our brain, it helps send messages to like all parts of our bodies, that it can affect your bladder, it can affect your bowels, it can affect your back, it affects your legs. So it does, cause weaknesses in other areas.
Right.
The other form of spina bifida is called meningocele. Meningocele occurs when the bones don't close around the spinal cord and the meninges are pushed out through the opening, causing a fluid-filled sac to form. The meninges are 3 layers of the membranes covering the spinal cord: the dura mater, arachnoid mater, and the pia mater. In most cases, the spinal cord and the nerves themselves are normal and not severely affected. The sac is often covered by skin and it can require surgery. It is the rarest type of spina bifida. Another form of spina bifida is myelomeningocele, and it accounts for about 75% of all the spina bifida cases. And this is the most severe form of the condition, in which a portion of the spinal cord itself protrudes through the back. In some cases, sacs are covered with skin, but in other cases, tissues and nerves may be exposed. Neurological disabilities are directly related to the location and severity of the spinal cord defect. So, like I said, you have your cervicals, your 1, your 2, your 3.
Mhm.
Then you go right on down your spinal cord, and you go into your lumbar region and all that good stuff. So depending on where your defect lands on your spinal cord is going to be where your involvement.
Right. So pretty much the way we've learned it is the higher up the spine, the more severe
Mm-hmm.
problems that you're going to have, or the more severe defects. The lower on the spine, the better off you are.
Well, yes, because when you're talking lower down the spine, we're talking about probably leg paralysis.
Right.
So the higher the spine, you're talking about up to your arms.
Right. And can start
Yeah.
involving like the urinary incontinence or bowel incontinence or problems along those lines.
So location is important, especially with this particular type of spina bifida.
Mm-hmm. There are some treatment options for spina bifida. Of course, this is going to depend on what type of spina bifida you have. With anything in medicine, the best thing you can do is prevent it from happening.
Absolutely.
That's
education, prevention.
Right. So if we start prenatal, that's where it really needs to start, and why women should be, especially of childbearing age, should be making sure that they're getting their folic acid. So we know that women of childbearing age can reduce their risk of having a child with spina bifida by taking the 400 micrograms of folic acid every day before conception, before they get pregnant.
So the goal is to go speak to your OBGYN, let them know, hey, I'm thinking about starting a family.
Right.
What do I need to do? And at that visit, they're going to tell you, okay, you're going to need to take a prenatal vitamin, and you might as well go ahead and start taking folic acid at this amount.
Right. And because folic acid is water soluble, it doesn't stay in the body for a long period of time. So it is something that has to be taken daily.
Mm-hmm.
About half of the pregnancy in the United States are not planned.
Exactly.
So having that conversation with your OBGYN ahead of time is great, but only for about half the population.
Who actually plans.
Yes. So if you are not planning on becoming pregnant, but you are able to get pregnant, you really need to be still taking like a multivitamin or making sure that you're getting your folic acid in.
Absolutely.
Because if you do get pregnant, most women go through the pregnancy, they have their child. You don't want to have a child that has spina bifida just because you weren't aware that you needed to be doing that.
Absolutely.
So as a childbearing woman, you just need to be making sure that you're taking your folic acid, either whether it's a multivitamin. I could never take multivitamins. They mess my stomach up. So when I was pregnant, I actually chewed Flintstones.
Hey girl, you got to do what you got to do. It's still a multivitamin.
I
don't judge, as long as you got them in, that's all that matters. Really.
So there's ways that you can work around that. Cause I know that was one of the big things for me is I just told my OBGYN, I'm like, look, I already don't feel that great in the mornings. And now you want me to take this multivitamin and well, let's try taking it at night. It doesn't matter what time you take it. Okay, great. Oh, that made for some miserable nights. And so it was just kind of one of those things that finally got to the point where it was like, okay, well, we're going to be chewing some Flintstones. It was easier for my body to digest. To me, it seemed weird, but it worked.
It worked. I mean, I give my son gummies. I'm not trying to be funny, but I give my son gummies. It's not anything to be ashamed about.
Right.
And I mean, honestly, if we're all doing our part as women, we really should be taking a multivitamin for women.
Right.
Most of the time when you find out you're pregnant, it's not in the first day, the first moment. And all the formation of this beautiful creature that you're creating is happening. And it's happening.
You don't know about it.
You don't know about it. And that's the time in which you need that folic acid because it's developing and forming.
Right. You can have fetal surgery. And there was a randomized study. It was called the MOMS trial, MOMS. And that compared repairing the deficit while the fetus was still in the uterus versus repairing it after birth. And there was mixed results on this. I think that most people know that there is always a risk when you puncture into a uterus of a pregnant woman.
Well, that amnio fluid.
Yes. Patients who underwent fetal repair were both less likely to need a ventriculoperitoneal shunt, and that was at 44% versus 84%, which is great. That's half.
Yeah, that's a big difference. Absolutely.
And they were also more likely to be able to walk. You had a 44% greater chance of walking versus a 24% chance.
And that's a huge difference too. I mean, these are double digits.
Almost.
Yeah.
Yes. And in the fetal surgery group, they had more maternal and infant complications. Of course, like I was saying earlier, anytime you poke into a pregnant woman's belly, there's risk. The current recommendation from the American College of Obstetricians and Gynecologists is that fetal surgery only be considered at specialty centers with a experienced team that pretty much that's what they do is fetal surgeries. And to be quite honest, that's the only place I'd want to have it if it was me.
Absolutely. It's kind of funny because I spent last weekend watching documentary on surgeons, and one type of surgeons they covered was neonatal, and how this particular surgeon dedicated his life to doing these fetal surgeries.
It's amazing when I worked in the OR for the little time that I was there. When you're doing any kind of pediatric surgeon, when you're talking, they have to understand the entire body. It's very rare that I met somebody that was a pediatric surgeon that then subspecialized down into a certain area. It was kind of like the pediatric surgeon was everything.
Yeah.
They were the GI, the vascular, they were everything. And it's just amazing, very knowledgeable, a lot of understanding. Did not ever want to work in an OR with peds again. When I was there, it was just tools should not be made that small. It's awful. It's great that we can do it, repair it. It's something that needs to be done. And I'm grateful for the people that can do it and love it. But it is amazing everything that they did.
It's hard because I mean, this particular episode that I watched was about an hour long, and you would always love to think of the happy ending and, you know, the baby being born healthy and, you know, thriving and all that, you know, that comes with growing up. But
it's not reality.
It's not reality. So the ones that, you know, didn't make it and the ones who went on to glory, you know, that physician, that surgeon, he took it home. It was personal. He very much connected with his patients through, you know, their entire pregnancy, because guess who they're going to see?
Right. And that's who you want to do your surgery.
Absolutely.
But it literally is taking, I'm sure, like his entire life.
Yeah, it did. And he recognized that, and his family recognized that, and he knew it was time, you know, he was getting to that time where he needed to go ahead and, you know, retire his passion.
Right. If fetal surgery is not for you, for whatever reason, you don't want to do it, or it's not recommended, you're not in a place where you can go to get to one of these experts, then the next option is infant surgery. And of course, again, this is going to depend on the type of spina bifida the child's born with, the severity. There's a lot that goes into this. But a baby that's born with spina bifida needs to have the exposed part of the spinal cord repaired, because otherwise they could injure it, or the number one thing I think of is infection.
Anything that's an open area is grounds for infection.
Right. And so a neurosurgeon will then place the neural tissue back in the spinal canal, and then we'll close the muscle and the skin, everything back up. And that procedure used to be considered a medical emergency and was done within a few hours after birth. Surgery now is usually done within the first 48 hours. It's not immediate. And I think that a lot of things with surgery, we're starting to realize, give it a day. Like, even if you break your arm, they don't rush you to an OR.
It's not an emergency anymore.
You know, they soft set it, put it in a cast, let the swelling go down, and then they do surgery. And of course, there are extenuating circumstances to that. But that's what happens a lot of the times when people are like, oh no, they need surgery right away. I'm like, they're going to set that and send them home. They're not going to have surgery. It's just the way it is. About 80 to 90% of children with spina bifida develop hydrocephalus. And hydrocephalus is a condition where excess cerebral spinal fluid builds up within the ventricles or the cavities of the brain, and that increases pressure within the head. That is not a good thing. You don't want pressure in your head like that. I mean, it's just not. The brain is soft and susceptible to damage. And most of those children require that ventricular shunt that we had talked about previously. And what that does is it drains the fluid. And that shunt remains in place throughout that person's life. And it actually may need to be replaced at times.
I'm sure throughout the lifetime it is probably replaced quite a few times.
Yes.
You know, each patient should have a baseline imaging and detailed neurological and muscular exams. Any physician, honestly, would be doing these.
Yes.
The most common cause of deterioration is often treatable, so assessments are necessary to identify them in a timely manner. Got to keep your checkup, guys. You got to talk to your doctors. You have to let them know when something's not right, and you need to show up for your appointments. If a child is a paraplegic, that means they don't have any movement in their legs from the hips down. They're going to need a wheelchair. And if a child is born with movement of the thigh muscles and feeling down below to the knees, the chances are good that he or she will be able to walk with some sort of brace support. And when there is no brain abnormalities, the child may have average or above average intelligence. And even if there is advanced hydrocephalus at birth, it does not mean that they're unintelligent.
Right.
Fortunately, with proper care, many children with spinal bifida, they lead very active and productive lives. A 20-year follow-up study of children with spina bifida showed that they entered college in the same proportion as the general population, and many are actively employed, With recent advancements in medical care for these children, their outlook continues to improve.
So again, this goes back to we are not our disability.
No, it doesn't define who you are. Your diagnosis never defines who you are.
And I think we need to remember that as not only people, but as nurses, just because somebody has a disorder or disability, disease, whatever you want to call it, it doesn't mean that they're not able to be productive citizens.
Absolutely. So nursing considerations,
Mm-hmm.
we always try to put these in because I feel like they're important. We're nurses.
Yes.
We do come across very variety of demographic of people, you know.
Mm-hmm.
Of course, like we were saying earlier in the episode, pregnancy. Not everyone can plan a pregnancy. We understand that. If you're thinking about starting a family, most definitely see your OBGYN. Let them know that you're interested in starting your family so that they can at least provide you with the information you need, the folic acid, and so that they can do testing and diagnostics. You know, you're going to want to follow up for your appointments, 20-week ultrasound, your infant ultrasound, any fetal MRIs, especially if you have a history of having children with spina bifida, or if spina bifida like runs in your family, you're going to want these preventative measures.
Mm-hmm. Absolutely.
For spina bifida patients, you're going to always perform newborn assessments, right? We all know that when babies are born, we do the APGAR score.
Yep.
And we take a physical examination. So you want to observe for the presence of abnormalities or physical defects. You want to note the spinal column, any abnormal tufts of hair or dimples on the infant's back that indicate a closed neural tube defect or a hidden occulta spinal bifida. You're going to assess and monitor for vital signs. That's nursing 101.
Yes.
You're going to gather your baseline information. You're going to monitor for changes or signs of complications. Once again, nursing 101. You're going to look for autonomic instabilities if there's possible spinal cord involvement.
Mm-hmm.
You're going to have to apply a moist, sterile dressing over any seen or exposed sac. Okay, so you're going to provide that dressing care as needed per your facility's protocol. And that moist dressing is to prevent drying of the sac. That can be a cause of it rupturing and put your patient at risk for infection. You're going to assess the temperature and the signs of infection, assess for irritation, redness, swelling, and drainage around the sac. And exposure of a fluid sac or spinal cord through opening in the skin definitely increases the risk of bacterial infection. This is all kind of nursing 101.
If you are doing your APGAR scale, you're looking to make sure that that child is healthy and appropriate. And you're
Mm-hmm.
doing that very frequently when a child is first born. So I think that a lot of this is if you just go back to your basic skills, and that's your foundation for everything in nursing.
Absolutely, because when I'm reading and going through this, care dressing changes, that's nursing 101.
It really is. If there's signs of infection, that's important. It needs to be noted, and the doctor needs to be made aware. Something needs to happen. Something needs to change. It's just kind of one of those things that I think that most people in nursing will automatically do because that's what you're trained. They ingrain this in
Absolutely.
in you
From day one,
school.
they keep it's repetition, but it's for a reason. Of course, you're going to want to make sure that you're, performing carefully and handling your patient carefully, and that change process of care activities are appropriate. You want to be careful to avoid any trauma to the sac or, to the spinal cord. So you do need to look for those things and just be more aware. And, surgical site care, it should be done using sterile technique following surgery to prevent infection. All of this is like what we've learned in Nursing 101 of wound care. You're going to want to make sure that you give any anticholinergics and antispasmatics because these patients might have some incontinence depending on where their defect is on their spine, which we also talked about earlier.
Right. And their age. I mean, we know that infants are
I mean, they
incontinent.
can't get up and go to the bathroom. Come
Bowel and
on.
bladder, but I
Yeah.
mean, you might be fixing this at a later age for whatever reason.
Yeah, it's just general patient care. And if they are incontinent, it could be more than just the bladder. They can also be bowel incontinent as well. So you're just going to note for the presence of neurogenic bladder and the amount of incontinent care that's required. Insert your urinary catheter, provide catheter care, and you're going to monitor your eyes and nose, which in nursing means your input and output. And you're going to provide incontinence care. We all know what that is. Making sure your patients are clean, making sure that they're dry, making sure that they're dressed. And if you have to perform intermittent catheterization, just educate the older patients that are able to possibly do it themselves.
Oh, absolutely.
I did a lot of that teaching to self-cath when I was a urology nurse. You'd be surprised how many people have issues not emptying their bladders for many different reasons. You're going to want to assist with bladder emptying as necessary. You're going to provide bowel and skin care, like we mentioned, to prevent skin breakdown. You're going to provide range of motion. You're going to promote strengthening and prevent contractures and atrophy of the muscles. That is not just a PT or an OT kind of job. It's our job as nursing too, because they do cover that. And this is why they cover it. You're going to provide assistance with assistive devices for mobility. Your patient might require like splints and braces and wheelchairs and other devices. And as he and she grows according to the level of the disability, provide resources of education for the parents, the patients, and the caregiver. You're going to want to make sure they have those resources available, any home care, and some tips on how to relieve anxiety. Provide emotional support and care for the patients and for the parents as well, to help relieve some of the stress by providing education and access to additional resources.
Of course, in nursing, prevention is one of the key things that we like to work on. Again, I know that we've mentioned this multiple times, but it's very important, which is why we keep saying it. Folic acid needs to be taken at least a month before conception, and it needs to continue throughout the entire pregnancy, because most or half of the pregnancies in the United States are unplanned. This really probably needs to be done daily, despite whether or not you want to get pregnant or not. When you consume those 400 micrograms of folic acid, it does reduce the risk of spinal bifida and other neural tube defects. So it's working in more than one way. There are foods, like we mentioned earlier, that are fortified with folic acid. Those include breads, and it'll tell you on there that it's enriched.
Yes, it does tell you.
Pastas, rice, and even breakfast cereals. And you can actually start looking at some of the packaging and you'll notice that this is already on there. Adult women who are planning pregnancy or would become pregnant should get that 400 to 800 micrograms of folic acid a day. And the body doesn't absorb folate as easily, so vitamin supplements are necessary to help prevent spina bifida. It is possible that folic acid will also help reduce the risk of other birth defects, including things like cleft lip, cleft palate, and some congenital heart defects. Foods that are naturally rich in folate: beans, peas, citrus, or citrus juices like orange juice, egg yolks, milk, avocados, and green leafy vegetables, and other things like broccoli, spinach, things like that. They're all really nutrient dense foods that we should be eating. And I'm a very big believer in eating the rainbow.
Absolutely.
So if you eat an assortment of foods that are all different colors, you're really going to be getting an assortment of natural vitamins and minerals.
Absolutely.
And I just like to eat.
I do too, so I can't say anything different.
And there are times when higher doses of folic acid are needed. So if you have spina bifida yourself, or if you have another child that has spina bifida, you may need extra folic acid before you become pregnant. So it's going to be very important that you have a little bit of planning going on there. or that you're naturally consuming more folic acid.
Mm-hmm.
So that way you're really working to prevent your child having spina bifida or having another child with spina bifida. If you're taking medicines such as anti-seizure medicines, or if you have diabetes, you may also benefit from a higher dose of vitamin B. And you also should check with your doctor or your OB, like your medical doctor or your OBGYN, if you need to increase your folic acid consumption or other supplements that you may need if you yourself have something that you're deficient in, or something that's caused from a deficiency, or have a child that has some kind of disorder that's related to a deficiency.
Absolutely.
So there's many different aspects that you have there. And I think it's really important, unless you're 100% healthy, you really need to be thinking through the process before you have a child.
Absolutely.
I mean, and when you're healthy, you can still have complications.
Absolutely. That's true. It's true. There are a lot of people that don't even ever have a history of spina bifida in their family that are healthy and still have children that have spina bifida.
Right.
So I feel like knowledge is power. Once you know better, you do better. It's just about educating your patients, educating yourself, and, educating people around you.
Right. Especially if you know somebody who is Hispanic and they're pregnant. Maybe it's a good idea to say, hey, just so you know, you might want to make sure that you're getting enough folic acid because you're at a higher risk.
Absolutely. I'm going to say, hey, did you have some orange juice today? Or,
make sure you're chewing your Flintstones.
Yeah. Make sure you're taking your prenatal vitamins. At least you'll show your friend that you're caring.
Right. And I don't think anybody would ever be offended by that.
Absolutely not. As always, we will link our references to our website, www.thenursingpostpodcast.com. Be sure to subscribe to our podcast on your favorite platform, and you can also leave your thoughts and comments. Thanks for listening to The Nursing Post.